Did you know that hypertension is the common cause of premature deaths globally? Did you also know that hypertension is the common cause of heart failure and the second most common cause of chronic kidney disease? Do you know why hypertension is described as the silent killer? If you want to learn more about hypertension, keep watching. Hello everyone, my name is Dr. Michael Yankee. This is my YouTube channel where we discuss everything concerning your health. If you are new here, kindly consider subscribing to this YouTube channel. Today we'll be covering a very important topic, which is high blood pressure or hypertension. Now, it's very important because in my earlier submission, I said or I described hypertension as a silent killer. And this is simply because for most people with hypertension, it has no symptoms. It doesn't present with any symptoms. And so it's described as the silent killer before you realize you are long gone. Now, I'll talk about hypertension. I'll talk about some of the causes of hypertension. Now, in order to understand what blood pressure is, you need to understand what pressure in itself is. Physiologically, pressure is when you have force being exerted over a particular area. Okay, so for blood pressure, or in the context of blood pressure, the force here is usually called the cardiac output. The cardiac output is simply the amount of blood that is ejected through the blood in each heartbeat multiplied by the number of heartbeats per minute. And the area has to do with all the blood vessels, the large size blood vessels, the medium sized blood vessels, the small sized blood vessels that leads to all the various organs, the kidney, the liver. When you open up those blood vessels, that constitutes the area. Now, usually when we are measuring blood pressure, we look at two figures. We look at the diastolic and the systolic. The systolic blood pressure is usually the figure above, and the diastolic is the one below. Systolic simply means that when the heart pumps blood or when the heart contracts. So this is a very beautiful model. This is your heart. So when your heart contracts or when your heart pumps blood, the pressure it generates is called the systolic blood pressure. Now, when your heart is relaxed, the pressure it generates is called the diastolic blood pressure. Now, the blood moves through all these vessels. These blood vessels moves through all these blood vessels to the various organs. All right. Now, I'm sure a lot of people usually ask for systolic blood pressure and the diastolic blood pressure. Which one is more important? We are usually concerned about the systolic blood pressure because an increase in the systolic blood pressure is of much concern to us. Now, for your blood vessels, for your pressure to increase, your blood vessels must be of a certain diameter. Your blood vessels have the ability to expand. Your blood vessels have the ability to stretch. Once your heart pumps blood through your blood vessels, because the blood vessels can stretch and the blood vessels can expand, it tends to increase the area, thereby reducing the blood pressure. If for any reason at all, especially in the aged or in disease state or patient who has excessive amount of cholesterol, this tends to affect the blood vessels and then it narrows the diameter of the blood vessels. And because of that, the pressure that is exerted on the blood vessels would increase. So simply, that is what high blood pressure is. Or I can give you an analogy. When you have a pipe or a tap which is connected to a hose pipe, the amount of pressure that will come out, the amount of water that comes out of the hose pipe is dependent on, number one, the amount of water that is coming through the pipe. Number two, the diameter of the hose pipe. And number three, the stretchability of the hose pipe. Now, the amount of water coming through the hose pipe is the amount of blood that is being ejected by the heart. Now, the stretchability of the hose pipe is what I mentioned earlier on, that your blood vessels have the ability to stretch. But if for anything at all in a disease state or in the aged, the blood vessels loses its ability to stretch, then it becomes very stiff, it becomes very narrowed, and therefore the pressure would increase. Now, in talking about the causes of high blood pressure, usually we have two types of high blood pressure. We have the primary hypertension and then we have the secondary hypertension. For the primary hypertension, sometimes is described as essential hypertension? Well, over the years, I've noticed that there's nothing essential about hypertension. You don't need to have it. Okay? Now, there are certain risk factors that can predispose you to essential hypertension. The first one is the aged population, as I mentioned. The aged population, once you are growing, your blood vessels tends to be stiff. Once you are growing, your blood vessels tends to be narrow, and so your blood pressure would automatically go up. That's the major cause of essential hypertension. The second cause of essential hypertension is genetics. Now, research has shown that about 80% of people with essential hypertension has to do with genetics. The ability of the kidneys not to excrete sodium. Now, once you have excessive amount of sodium or salt in your system, it tends to increase your blood volume. And once your blood volume increases, the pressure will go up. So for some people, their kidneys have this abnormality where they are unable to excrete excessive amount of sodium. Now, you must know that for essential hypertension, it's usually found in 90% of patients with hypertension. And then for 10%, they have secondary hypertension. So what that simply means is that if you pick 10 people, 9 out of the 10 people with hypertension are likely to have essential hypertension or primary hypertension. What it also means is that for primary hypertension, usually the cause is unknown. We don't really know what the cause is. What we talk about are risk factors. So the first risk factor I've mentioned is the aged population. Once you grow, your blood vessels tend to be stiff, your blood vessels tend to be narrowed, and so it increases the pressure. The second risk factor is genetics, where people have kidney abnormalities such that they are unable to excrete sodium. The second risk factor for primary hypertension, smoking. Smoking tobacco, cannabis, they tend to affect your blood vessels, and so it narrows or it hardens your blood vessels, and therefore once it becomes very narrow, then it means that the amount of pressure that is generated increases. Another risk factor for primary hypertension is diabetes. So once you have excessive amount of sugar in your blood, okay, is the hyperinsulinemia that tends to paralyze your blood vessels. The excessive release of insulin tends to paralyze your blood vessels. And once it paralyzes your blood vessels, it reduces the diameter of your blood vessels and tends to increase your blood pressure. Another risk factor for primary hypertension is obesity. Now, about 50% of our population are obese. So much obese. Obesity tends to cause primary hypertension. Another risk factor for primary hypertension is high sodium intake. People are so much obsessed with taking a lot of salt. Eating salt, putting a lot of salt in their food, it tends to increase your blood volume and therefore increases your blood pressure. Another risk factor for primary hypertension is family history. Now, I'm speaking passionately about this topic from a very unique position because my father is hypertensive. And it means that I am at risk of being hypertensive. Family history, hypertension sometimes runs in the family. Another risk factor is race, black race. Research has shown that a lot of people with hypertension are blacks. So if you are a black man watching me, you need to check your blood pressure regularly. Now, the second type of hypertension is called secondary hypertension, which tends to occur in about 5 to 10% of the population. Now, for secondary hypertension, there is usually an underlying condition that is causing the hypertension. So, for instance, if you are 30 years and below and you are not obese and you've been diagnosed of hypertension, your blood pressures keep going up, it's more likely that your hypertension is due to a pathology or an underlying condition. If your blood pressures tends to go up before puberty, it's more likely to be a pathology. Now, if you are also less than 30 years, your blood pressures tends to go up. Antihypertensives are not controlling your blood pressure, then it's more likely to be from a pathology. Now, chronic kidney disease can cause high blood pressure. I know earlier on I said that hypertension can cause chronic kidney disease. Also, chronic kidney disease can also cause hypertension. That's a secondary cause of hypertension. So it can affect your kidney to cause chronic kidney disease. Metabolic syndrome. Metabolic syndrome is simply a group of risk factors that predispose you to heart attack, stroke, diabetes. Okay. Now, another cause of secondary hypertension can be a malignancy. You can have a tumor of your adrenals. Adrenals are certain glands that sits on your kidney that helps to regulate your metabolism. And so once you have tumor over there, usually called pheochromocytoma, you tend to have an increase in your blood pressure. Another cause of secondary hypertension can be a congenital malformation called a coarctation of the aorta, where you have kinking of your blood vessels. So once you have kinking of your blood vessels, it means that the blood cannot flow well, and therefore it will increase your blood pressure. Another cause of secondary hypertension can be preeclampsia. A pregnant woman can have hypertension, especially in a third trimester, because the placenta tends to release certain chemicals in the blood, which tends to constrict your blood vessels. And once your blood vessels are constricted, you tend to have hypertension. These are the few things I want to share with you for today. I hope you've learned a thing or two. Kindly like, share this video to your loved ones, anyone who has been diagnosed with hypertension. Share this video with a person, and most importantly, kindly subscribe to my YouTube channel. I'll see you in the next video, and remember, your health is your wealth. Bye-bye.